You can see this lamb, that the lamb eating lamb who eated calcium channels at neuromuscular junctions. Okay, so this is autoantibodies or anti-calcium channels. So autoantibodies, calcium channels, presynaptic motor neuron, neuromuscular junction. Okay, so there's problem at that point. There will be no acetylcholine release from vesicles, and if acetylcholine receptors have no acetylcholine to attach, there will be no depolarization and no muscle contraction. All right. Okay, so as you can remember this by this thing that I dislike calcium and its products, just lazy and weak. Okay, so what will happen? The proximal muscle weakness, tendon reflexes depressed and absent, and autonomic symptoms and stuff like that. Okay, so as you can see that the motor neuron, calcium channel, vesicle filled with acetylcholine, but here the acetylcholine receptors are not open. Okay, so someone please open calcium channel and get me acetylcholine. If there is no calcium channel, there will be no acetylcholine. All right, and always remember that the Lambert-Eaton syndrome is associated with small cell cancer. As you can see that this man already has cancer to deal with, and you are destroying calcium channel. That's how you can remember it. Associated with small cell carcinoma, I've told you, and more in smokers, it is very poor prognosis, and it has Lambert-Eaton syndrome has negative edrophonium test. However, mysthenia has positive edrophonium test. All right, how we will be targeting the treatments? We will reduce the autoantibodies for calcium channels, and how we can do that? We can do it by immunosuppression, plasmapheresis, and intravenous immunoglobulin. However, the most important point here is 3,4-DAP. All right, 3,4-diaminopyridine has it works by that increase acetylcholine in the synaptic cleft. How we can do this? By 3,4-DAP and by pyrrostigmine. By increasing release from presynaptic vesicles. And how it works? By inhibiting lysis of cholinesterase. Let's come back to our topic from past medicine, that the Lambert-Eaton mysthenic syndrome, we call is LEMS, is seen in association with small cell lung cancer, as I've already told you, and to lesser extent with the breast cancer and the ovarian cancer. It may occur independently as an autoimmune disorder. All right, Lambert-Eaton syndrome is caused by antibody directed against presynaptic voltage gated calcium channels in the peripheral nervous system. I have shown you the picture, and I really hope that now you will not forget it. All right, so what will be the picture? This is the most important picture, and this is the most of the time MRCP like to ask you. Okay, so repeated muscle contractions lead to increased muscle strength. However, it doesn't happen in myasthenia gravis. Repeated muscle contractions will lead to decreased muscle strength in myasthenia. Okay, so in reality this is seen in only 50% of patients, and following prolonged muscle use, muscle strength will eventually decrease. Next is limb girdle weakness. It most commonly affects lower limb first. I will also show you the difference between Lambert-Eaton and myasthenia later on. All right, don't worry. It has the hypodysplasia, and the next is autonomic symptoms like dry mouth, impotence, and difficulty micturating. All right. However, as we know that in myasthenia gravis, ophthalmoplegia and ptosis are commonly a feature of them, but in Lambert-Eaton they are not. Electromyography is very important point in Lambert-Eaton syndrome, and there is incremental response to repetitive electrical stimulation. All right, so the management is that we will treat the underlying cancer like small cell lung cancer or breast or ovarian. There will be immunosuppression, for example with prednisolone and azathioprine, and 3,4-DAP. I've told you in the previous picture also. Diaminopyridine works by blocking potassium channel efflux in the nerve terminal, so the action potential ratio is increased. That's how it works. Okay, so then what will happen? That calcium channels can then be open for a longer time, and they will allow acetylcholine release to stimulate muscle at the end plate. Last but not the least is IV immunoglobulin therapy and the plasma exchange or plasmapheresis. Let me show you the last thing I want to tell you about it. Okay, so this is the classic MRCP investigation, that EMG finding incremental response. What is incremental response? That repeated stimulation leads to stronger muscle response. This is really MRCP favorite. let us see the difference between LEMS and MG. Okay, so the weakness is proximal legs first in LEMS, and myasthenia has eyes. Reflexes, LEMS in LEMS reflexes will be reduced. Exercise improves strength, autonomic common, and when it is associated tumor, then in LEMS it is small cell lung cancer, and in MG it is thymoma. All right, antibodies, autoantibodies against calcium channels, and here against acetylcholine receptor. Okay, here, that's it.